Another thing is our apocrine glands, apocrine sweat glands are present in armpits and groin area. So here it is controlled by sympathetic nervous system, alpha 1. So on stressful situations, it stimulates alpha 1 receptor that leads to sweating here. It is not controlled by acetylcholine, it is controlled by alpha 1 receptors. That is one thing. And the point we need to include here is propranolol is used here because it is a non-selective beta blocker, beta 1 and beta 2. It blocks, it is a non-selective beta blocker. So in stressful, if we suppose performance anxiety, like we might perform better or not, that is performance anxiety, there will be our amygdala is very much fearful and our prefrontal cortex fails to suppress that activity. So it ultimately leads to increased sympathetic activation and ultimately leads to palpitation, body cooling and sweating. So that ultimately increases the amygdala fear. So it becomes a vicious cycle. So to reduce this, if we can use propranolol for this purpose in performance anxiety, it acts on beta 1 receptors, reduces the palpitation. So that's how we feel less about the stress. So that is the symptoms are reduced by the propranolol, not the cause actually. So if we feel, if the symptoms are reduced, it breaks that vicious cycle. So then there's a chance of feeling better. That's why propranolol is choose for this purpose.